The thyroid is a small, butterfly-shaped gland located in the front of the neck. It plays a crucial role in regulating metabolism, energy levels, body temperature, and even heart rate through the hormones it produces, primarily thyroxine, T4, and triiodothyronine, T3. When the thyroid becomes overactive or underactive, it can lead to various health issues. Common thyroid disorders, hypothyroidism. This occurs when the thyroid doesn't produce enough hormones. Symptoms include fatigue, weight gain, cold sensitivity, depression, dry skin, and constipation. The most common cause is Hashimoto's thyroiditis, an autoimmune disorder. Hyperthyroidism. This is when the thyroid produces too much hormone. It can cause weight loss, rapid heartbeat, irritability, anxiety, and heat intolerance. A common cause is Graves' disease, another autoimmune condition. Goiter and enlarged thyroid, often due to iodine deficiency or thyroid dysfunction. Thyroid nodules, lumps in the thyroid gland. Most are benign but can sometimes produce excess hormones or become cancerous. Thyroid cancer, less common but highly treatable, especially when detected early. How to fix thyroid problems, medical treatment. Hypothyroidism is typically treated with synthetic thyroid hormone, levothyroxine, to restore normal hormone levels. Hyperthyroidism may be managed with anti-thyroid medications, radioactive iodine therapy, or sometimes surgery. Thyroid cancer treatment often involves surgery, radioactive iodine, and sometimes hormone therapy. Lifestyle and diet. Adequate intake of iodine, selenium, and zinc supports thyroid health. However, supplements should be used cautiously. Reducing stress, getting enough sleep, and avoiding environmental toxins may help balance thyroid function. Monitoring and regular blood testing, TSH, T3, T4, help monitor thyroid health and guide treatment decisions. Alternative therapies. Some people explore acupuncture, herbal remedies, or functional medicine approaches, but these should be used alongside standard care and under a doctor's supervision. If you suspect a thyroid issue, consult a healthcare provider. Early diagnosis and proper treatment can significantly improve quality of life. Please like, subscribe, and share this message.